Well, a bill crafted after criticism of Mission Hospital's nonprofit sale to for-profit HCAs headed to the state Senate.
The bill was written to demand more transparency around future hospital sales, but we've learned that portion was stripped out.
Tonight, we're asking what oversight did the bill call for with hospital sales?
And News 13's Kimberly King joins us live from Mission with the answer on that. Kim, what can you tell us?
Tammy, Mission's deal with HCA done 7 years ago was largely done behind closed doors. Now, the proposed bill required that more entities such as the state auditor or the treasurer review any proposed sale transaction, but all of that, as of this morning, has been stripped.
Senator Mayfield, have you crafted this proposal in light of what you perceive as negative fallout from the sale of Mission to HCA?
I have.
That's what State Senator Julie Mayfield said today about a bill to reform hospital competition and demand more transparency.
You've shared now that Republicans have told you they will not accept the bill as it was and took out that whole chunk. Wasn't that the meat of your bill?
That was a very important part of the bill, and it has come out for the time being.
Here's some of what was written. Prior to any transaction, the entity shall provide the state auditor, attorney general, and treasurer written notice and publish written notice of the transaction. All of it's now been stripped. Mayfield says provisions to protect whistleblowers at hospitals remains in.
This would prevent retaliation by HCA against employees for instance, talking to DHHS and CMS surveyors.
She says Mission fired nurses for telling agencies about concerns. A Mission spokesperson, however, said the hospital disagrees with Mayfield's statements, saying staff have many ways to report concerns without retaliation.
Well, my mother worked as a nurse, my dad is a PA.
Asheville resident Pentelis Danielle Nielsen supports the bill's intent. The fact nurses have spoken out saying HCA understaffs, Nielsen says, is a concern for him.
I know well that when places get understaffed and possibly treated as a business that needs to generate profit, then that is definitely going to affect both the health of the caretakers as well as the patients.
I want to know that my healthcare professionals, if something is wrong, they're going to speak out.
Brevard's mayor has also been an advocate for her community that has an HCA hospital. Concerned, she says, about patient care. She supports Mayfield even with what's left of the bill that includes a provision hospitals wouldn't be allowed to make doctors sign non-competes.
After HCA bought it, and so they have had to leave the region. This legislation would keep that from happening in the future.
Now, I did reach out to sponsor Senator Jim Burgin, who is a lead sponsor, to ask him about the understanding that we have that Republicans basically quashed that large portion of the bill. We did not hear back. Meanwhile, Mission spokesperson tells me the hospital's been named one of America's 50 best for the 11th consecutive year in a row, and that HCA has invested $10 million in employee raises this year. Reporting live outside Mission Hospital in Asheville, Kimberly King, News 13.